Quite another question.
Yeah. Hi,
But
I'm Robin Herman. I'm the director of the forum, and one of our...
We're not hearing you.
Right. But we have one of the features of the forum is that we can take questions from online viewers. I have two questions. One is a quick one to Dr. Block from someone in Los Angeles who tweeted in this question about whether toxic stress can begin in utero.
Certainly can. We have good science to back up the fact that this whole process begins as the brain is beginning to develop and make connections. There's a very dynamic neuroscience around the evolution of brain development and continuing development in the fetus. So I think that, and there's good science to support that maternal stress and other stressful events during gestation can have an effect on the fetus and can continue on then through childhood.
These studies were done during wartime and famine, I believe?
Some in wartime, and another study that was done was very, didn't take anything that dramatic. It was done during an ice storm in Canada, where mothers were isolated from all sorts of resources, and they studied and were under a great deal of stress because they couldn't find food, they couldn't get to work, they couldn't do whatever they needed to do. And then when they looked at about 4 or 5 years of age at their children compared to children who hadn't gestated during that time of isolation and stress, there were great difference in language abilities and cognitive abilities. Okay. So it can be almost anything.
Very interesting. We've gotten a number of questions from people who are, out in the field, really working with children, not necessarily as pediatricians, but in daycare centers and other kinds of community centers. And we have one here from Lori Bozeman, who's the owner-operator at Little Sprouts Daycare in Brunswick, Maine. And she asks, what do you see as the role of child care in either helping to create the toxic stress in children or to help alleviate the toxic stress in children? It seems when we had less homes with dual working parents, there was not as much incidence of developmental, behavioral, and social concerns with children. I don't know what you have to say about that. And then, but she says that there are strict guidelines that are in place there at, for anyone who's doing daycare about how much they can intervene. When a facility suggests screening for a child due to repeated observation of developmental delays or behavioral issues, a parent has the right to refuse the screening. How do we reconcile these problems with confidentiality?
Well, I'll take on the science part of this. I mean, I think this is a good opportunity to help everyone remember or understand for the first time that we're talking about basic biology here. So a lot of what we know comes from studies of animals, comes from studies of non-human primates, it comes from studies of mice and rats and a variety of other animals, and a lot of studies of humans. And this has to do with the extent to which the body responds to a sense of threat or stress. And it's important to also recognize that a certain amount of stress is unavoidable. So when the brain is responding to an absence of what it's expecting, the brain is not saying, well, this is not coming from my mother, or this is not coming from someone who is genetically related to me, or this is coming from a child care center. Oh, no, maybe it's a preschool program. No, maybe it's a play group in the community. From a brain point of view, I don't mean that there's no difference between some random person and your parent, but brain point of view, it's whether there's a sense of threat and whether something is protecting you or not. So it would, through a science lens, differentiating what goes on in a child care center from the home, from the neighborhood, is really not relevant. I don't mean it's not relevant in your life, but the question is, does the body sense safety, or does the body sense threat? And we know from a huge amount of research on child care and home rearing, independent of neuroscience, is that good environments produce healthy development, and poor environments threaten development. It's not whether home or child care is better. It's whether it's a good quality place wherever it has to be and who the people are. And that's really important. This is not about changes in working patterns and who's taking care of kids, because children grow up in all kinds of environments all across the world, in all kinds of cultures. And the brain isn't acting differently there. The brain in each of these contexts is sensing either a sense of safety and security or a sense of unprotected danger.
And now getting to the confidentiality and how much they can intervene.
Well, you know, I think you have to start at the beginning, and we do have issues of confidentiality. We have issues of all sorts of programmatic things. We have issues of compartmentalizing kids. Are you a child of an immigrant family? Are you a child of the third, fourth, fifth, sixth generation living in poverty? Are you a child who has experienced lots of healthcare disparities? It really doesn't matter because you still are a child. You have a brain. That brain is developing along what we now know are tracks that are determined by what's going on around you. So we have to pay attention to that bottom line first. The problem that the questioner brought up is easy. If there's a problem with what she can discuss it with a family and the family's right to refusal, that's just two people arguing about it. So then we bring in a real public health approach. We get a community behind them. So perhaps the pediatrician who's taking care of that child can be part of that conversation. Perhaps a visiting nurse can be called in. You know, other people can. And rather than saying to the parents, you're a problem, what we have to say to the parents is there's some things going on in your life that are having a tremendous effect on you and your child. Let's see if we can figure out a way to help and make that situation better.
More questions, right here. Yeah. Okay, you go first. Okay.
Michelle Albert, Brigham and Women's Hospital Cardiovascular Division. So as an adult cardiologist, one of the things that I'm very interested in is both Dr. Shonkoff's comment and Dr. Block's comments about the different silos in which we exist. So you're pediatric silos and we're in internal medicine silos. And it would seem to me that we would need to create a bridge between those two in order to advance the agenda that has been described. So I am curious about strategies, low-hanging fruit, that either of the members on the panel that might suggest that could be done immediately.
Well, I'll kick in first on that. I think that the wall that separates us is artificial, and it goes back to the fact that all of your patients who are adults once were children. And if we can find ways to communicate about their health situations, both physical health, mental health, their development, that will bring us back together again, because after all, we're all about health of the individual patient and groups of patients together. So I think that Jack and his team are on target when they talked about in the technical report that supported the policy statement that we have to tear down these separations of saying you have one interest and we have another. That's really not true, and I think we would agree that our interest is the patient from before birth all the way up to the end of life. That's a concept that I think if we can get public as well as policy persons to understand, we can develop more science, we can develop funding for that science, we can integrate that science into our clinical practices in whatever specialty that we're dealing with, because the diseases that we know are tied to the reactions to stress are multiple. So I think there's some real hope that this will be a way for us to start focusing on our patient doesn't change on their 5th birthday or 15th birthday or 40th birthday. It's the same person.
You know, I'd add to that, and this is, again, a wonderful question to get at this silo issue, so those of us who live in universities understand the problem of silos of different schools and departments. And in the healthcare system, people understand the silos of the different subspecialties. And in Roberto's world, there are the silos of the health people and the education people and the human service people and the agriculture people and the labor people. And so, and everybody, there is no national association for the preservation of silos. So everybody says silos are bad, we need to cooperate. But what happens is the best attempts are kind of interagency agreements, people trying to kind of set up ways to share data systems. Another thing that's new about this science is this says, how about everybody looking at the same science that really relates to all of your worlds, and think about how that could change the way we might work together, rather than think about how we could break down silos, because breaking down silos is tough to do unless you have some new reason to kind of get together. And this science is a new reason. It's as much about health as it is about education. It's as much about pediatrics as it is about gerontology. It's as much about being a Republican as it is about being a Democrat. I don't mean to kind of put a new lens on this, but it's one science, and it's one science that doesn't have a magic answer to everything, but it has a new way to start thinking together about different kinds of solutions.
But what about resilience?
Sounds like Roberto would like to
Roberto, sorry, could you chime in here?
Just very briefly, I think Jack very eloquently painted the imperative here for us to better integrate our policies and our existing systems that are serving our kids, so that we're doing a better job of really pulling together around the science, around what works, and around quality standards and a continuum of quality and care for our kids. I think this is the vision that we have really tried to paint behind our Race to the Top Early Learning Challenge. We now have 9 states that have picked up that mantra. They're working to really review on a comprehensive level their state-level policies and practices and programs to focus more on a view of the whole child and on their success. And here, I think the important lesson here is the psychosocial well-being of our kids and these elements of toxic stress in the lives of our most vulnerable children really has to be on the forefront there. It has to be on the forefront of what we do with our child care system and our child care subsidy system, just as it has to be on the forefront of our pre-K system, regardless of where our kids are spending time.
It seems as though there's sort of a search here for leadership, for some element to sort of break down the silos and sort of put this together. Is that a job for the president? Roberto, to you.
We have to model that behavior at the federal level, right? I think this is why we've said in our child development policy here, we're going to have our Department of Health and Human Services, the Administration for Children and Families, lashed up with our Department of Education, and we're going to try to do more to make sure that we're modeling that interagency collaboration. We've started to give some grants to states to start to do more of this interagency work, this coordination and planning with kids and their needs and their well-being at the center of that work. We need to model that at the federal level if we're going to expect that behavior at the state level and at the local level, because it does, moving away from these silos does require folks to do things differently and cede some of their territory in some respects to a bigger vision.
Yeah, and is this something that the president would make a priority, make a speech about, take a leadership role on this?
Yeah, this is something that's very important to the well-being of our kids, but to our broader prosperity as a country. And this is why he's talked so much about early learning and early childhood development. He has spoken about that in a number of his speeches about education. We had all of our 9 Race to the Top Early Learning winners here at the White House just in December, and we had both Secretary Sebelius as well as Secretary Duncan welcome those practitioners and those state-level policymakers really to be leaders and develop the models that will help move us forward as a country, because there's no silver bullet solution here. I think it really requires us having a more systemic look at the well-being of our kids and putting that front and center. So our administration is going to remain committed to that goal.